to this short video. So this video is prior to the detailed anatomy of tongue, because before learning the detailed anatomy of tongue, we should know about the oral cavity and the soft palate. So the oral cavity or the mouth. So in this video, I will explain you briefly about the parts of oral cavity. That means exactly how it is divided into vestibule of mouth and oral cavity proper. And we will learn the brief anatomy of the lips, cheeks and the gums. And again we will enter to the roof and floor of oral cavity. Thank you. The mouth or the oral cavity can be divided into two parts. An external part called as vestibule of mouth and an internal part called as oral cavity proper. So this subdivision is by the alveolar process, gums and the teeth. So the alveolar process, gums and the teeth divides the entire oral cavity into a small external part called as vestibule of mouth and a large internal part called as oral cavity proper. So first let us learn a little bit about the vestibule of mouth. So the vestibule of mouth externally is limited or bounded by the lips and the cheek, and internally that is bounded by the teeth and gums. So the cleft or the space between teeth and gums and the lips, or teeth and gums and the cheek, this is called as vestibule of mouth. So when the upper and lower set of teeth are together, that means when the closed position of the mouth, so this vestibule of mouth is communicating with the oral cavity proper behind the third molar tooth and in front of ramus of mandible. So in between ramus of mandible and the third molar teeth, there is a gap. This gap is the communication between the oral cavity proper and the vestibule of the mouth. So to the upper vestibule of mouth, very close to the upper second molar teeth, so that is the crown of upper second molar tooth, there is an opening of the parotid duct. So the parotid duct is opening at the vestibule of mouth at this site. Next we will learn the oral cavity proper. The oral cavity proper, that is the posterior larger part of the mouth. Anterior smaller region we have learned as vestibule. The posterior larger part we are learning as the oral cavity proper. So the roof of the oral cavity is the palate. Anteriorly that is hard palate and posteriorly that is soft palate. And the floor, posteriorly that will show mainly the muscular organ called as tongue, and the anterior part of floor of the mouth, that is the sublingual region. On either side we have the alveolar arch with the teeth and its gums. So this will bound the lateral aspect of the oral cavity, and external to it we have the vestibule of mouth that we have already learned. And anteriorly the oral cavity communicates with the vestibule of mouth, and the posteriorly the oral cavity is opening to the oropharynx through a communication. This is called as oropharyngeal isthmus. So this communication of oral cavity proper and the oropharynx behind, this is called as oropharyngeal isthmus. The oropharyngeal isthmus superiorly is bounded by the soft palate, and inferiorly we have the posterior 1/3 of the tongue, and on either side we have a mucosal fold called as palatoglossal fold, in which we have a muscle, palatoglossus muscle. So these palatoglossal folds we have on either side as the boundary of oropharyngeal isthmus. The anterior aspect of the oral cavity proper, that will form the sublingual region, and here we can see a midline mucosal fold which connects the ventral surface of the tongue to the floor of the mouth. This mucosal fold is called as frenulum of tongue or frenulum linguae. Next to learn at the sublingual region is sublingual papilla. or sublingual papillae. So here this is an elevation on either side of the frenulum linguae. So this is the frenulum linguae. On either side you can see two small elevation, that is called as sublingual papillae. To the summit or the apex of this papillae we can appreciate two openings. These openings are the duct of submandibular salivary gland. And remember, from the sublingual papilla region you can see an extension laterally and backwards. This is called as sublingual folds. And remember, the edges of the sublingual folds we can appreciate very tiny opening. These openings are of sublingual salivary glands. Few sublingual salivary glands are opening on at this region. Next we will learn the gums. Gums are also called as gingiva or gingivae. So by definition, gums are the soft tissue covering alveolar process of jaw bones. So this is the alveolar process of upper jaw and this is the alveolar process of lower jaw. The alveolar process bears the sockets for the root of the teeth. And here these alveolar process, these parts are covered by the soft tissue which is called as gums or gingivae. This gums or gingivae shows two parts. So this is the picture to show you the two parts of the gums. So the first part is free part, which will cover the neck region of the tooth, which will completely envelop like a collar. And again we have the attached part, which will connect or bind these gums to the alveolar process. So that is called as attached part. Here in this picture, attached part is also shown and also the free marginal zone also is shown. So the inflammation of the gums that can happen, that condition is called as gingivitis. So we got that term which is derived from gingivae, because gingivae means the gums. Next we will learn the lips as a part of oral cavity or the mouth. So the lips, by definition, this is a mobile fibromuscular folds that bounds the oral fissure. So this is the fibromuscular folds. We have an upper fold called as upper lip, lower fold called as lower lip, and these two lips are bounding the oral fissure. That means the oral fissure above is bounded by the upper lip and below by the lower lip. Upper lip and the lower lip meets at the corner of the mouth on either side. So on left side here, this is the meeting point of upper lip and the lower lip. On the right side, this is the meeting point of upper lip and the lower lip. So here the vermilion. So the vermilion zone is the reddish part of the lip, and this reddish discoloration is due to rich vascularity underneath. And the vermilion border is the border between this vermilion and the neighboring ordinary skin. So this is called as vermilion border. There is a median shallow groove exactly at the median plane of the upper lip. So this is called as philtrum of upper lip, or also called as Cupid's bow. Next, let us see what are the different layers of the lips. So we will trace the lips from external to internal aspects. So utmost area is covered by the skin. And next, deep to the skin, we have the superficial fascia. And again we have in the superficial fascia, deep to superficial fascia, we have the muscle fibers, that is the orbicularis oris muscle. Again, we have the submucosa where we can see labial glands and blood vessels. And then we have the mucous membrane of the lips. Remember, the mucous membrane of the lip that will be continuing as the mucous membrane of the gums at the vestibule region. Next to learn is the cheeks. The cheeks are the fleshy part of the face which is extending from the corner of the mouth till the anterior border of masseter muscles. So this region is called as cheeks. And remember, this cheek is forming the lateral boundary of our vestibule of mouth. Let us analyze what are the different layers of the cheek. Earlier we were learning different layers of lips, but now we are learning different layers of cheek. The cheek is made up of the outermost layer which is called as the skin. Again, next to the skin we have the superficial fascia. Superficial fascia of the cheek is very important because there you have the buccal pad of fat, and also certain muscles are there like our zygomaticus muscles, isorius muscle, and also we have the parotid duct, the duct of the parotid gland which is coming forwards. So that will be through the superficial fascia of this cheek region, and later this duct will pierce certain structures before opening to the upper vestibule of mouth. Again, we have the buccinator muscle. Another layer is the buccinator muscle, that is the muscle of this cheek. Next we have the submucosa where you can see the buccal glands. Okay. And next we have the mucous membrane, which is the mucous membrane of our oral cavity, that is stratified squamous non-keratinized epithelium. So these are the layers of the cheek. The buccal pad of fat will be very clear and prominent in newborn babies.